Namaste, Dr. Divya here, and welcoming you all in the session of yoga therapy. We are going to start about the new section, which is the cardiovascular diseases. In this section, we are going to learn about the hypertension and role of yogic diet and what types of things you should learn in the yoga therapy aspect. So let's begin. So the hypertension, it is known as high blood pressure, is when the pressure in your blood vessels is too high. It is common in 120 to 80 is a universal. When it is higher, it is known as hypertension. If it's not treated, people with high blood pressure may not feel the symptoms sometimes. The only way to know to get it your blood pressure when you have checked it. Things that increase the blood pressure, having high blood pressure, which includes the older age. When you are getting older, your blood pressure rises. Genetics is one of the reason. Being overweight or obese and not being physically active also. Some people are taking high salt diet also. Drinking too much of alcohol. Lifestyle changes like eating a healthier diet, quitting tobacco, or being more active can help to lower the blood pressure as well. Some people may still need to take the medicines as well. Blood pressure is written as the two numbers. The first one is the systolic number, which represents the pressure in the blood vessels when the heart contracts or beats. The second is the diastolic number, which represents the pressure in the vessels when the heart rests between the beats. So, in which the hypertension is particularly diagnosed if when it is measured on two different or 3 days consecutively. On the same time, you can check. The systolic blood pressure readings on both days is the more than 140 or 150 equals to mmHg, and the systolic have more than 90 100 mmHg or equals to. So risk factors, the modifiable risk factors include the unhealthy diets, excessive salt consumption, a diet high in saturated fat and trans fats like packet foods, low intake of fruits and vegetables can also cause hypertension. Physical inactivity, consumption of tobacco, alcohol, and being overweight or obese. In addition, there are environmental risk factors for hypertension and also associated diseases, where air pollution is the most significant. And I must say that the non-modifiable risk factors include a family history. Like my father has the hypertension, so maybe I have the chances more to get it. The age over 65 years, like coexisting disease such as diabetes, kidney disease, etc. Symptoms of hypertension. Like most people with hypertension don't feel any symptoms. Very high blood pressures can cause headaches, yes. It can cause the blood visions, yes. The chest pain and other symptoms. Checking your blood pressure is the best way to know that if you have the high blood pressure. If hypertension isn't treated, it can cause definitely other health conditions like kidney diseases and also along with that heart diseases and stroke. People with high blood pressure, usually you can say the 180 to 120, which is very higher, can experience the symptoms even like this, like severe headaches. They can feel the chest pain, dizziness, difficulty in breathing sometimes, nausea, vomiting, blood vision, and other vision changes you can find in them. Anxiety, confusion, and buzzing in the ears you can find those who have the high blood pressure. Okay, and they cannot even found to do something, like they don't want to do something because the pressure is so much high, and nose bleeds also sometimes, abnormal heart rhythms. And if you are experiencing any of these symptoms and a high blood pressure, seek actually the take care immediately. The way to detect hypertension is to have the health professional go towards the doctor or some clinic, measure the blood pressure. Having blood pressure measured is quick and painless. It is very simple. Although individuals can measure their own blood pressure as well using the automatic devices. And also the evaluation by health professional is important for assessment, that yes, maybe your doctor will tell, okay, you have this problem, so definitely go for it. And what are the treatments in it? So lifestyle changes can help to lower the high blood pressure. These things include eating a healthy, low salt diet, losing the weight, and sometimes some people are very lean but they also got the high blood pressure, I must say. So physically active you should be, okay? Quitting tobacco. If you have the high blood pressure, your doctor or your healthcare provider recommend that for some medicines also. So your recommend blood pressure may depend on what others conditions you have. And also the blood pressure when you have, so blood pressure goal is less than to the 130 to at least 80. And if you have the cardiovascular diseases, stroke you can get, diabetes is also chronic kidney disease, high risk for cardiovascular diseases. For people, the goal is to have that the blood pressure less than should be um, 120 to 90 as well, okay? And also 120 it's a universal, and if it's 110 to more and less then also it is fine. So this is the things you can perceive in during when you have the hypertension. And there are a lot of medications also, like the calcium channel blockers. It includes the antidopamines, etc. So you should take these kinds of medications under the guidance of your doctor. So what are the preventions during the blood pressure? So the prevention, you should take care of it, that the lifestyle changes, definitely in diabetes and in hypertension. In these two conditions, if you are taking care of your lifestyle, it will definitely reduce the symptoms as well, and can help anyone with hypertension. Many who can make these changes will still need to take medicine sometimes, or even not also. These lifestyle changes can help to prevent the lower, the high blood pressure. So the do's are eat more vegetables and fruits, sit less, and also be more physically active, which can include walking, running, swimming, dancing, or activities that build strength, like lifting the weights sometimes. Or for the older adults, I will not recommend this, okay? And also get at least 150 minutes per week of moderate intensity of aerobic practices, and not vigorous one. I must say, in yoga you can do you can avoid actually the forward bending postures, even the inverted postures you should avoid during the practice of yoga. You can go with a very little bit of warm up, and afterwards slowly type of sukshma vyayam, which is very good for the hypertensive patients, and even the older adults can do it. The pranayam you can avoid, which is the bhastrika. Kapalbhati is a shatkarm, the cleansing practice, which you can avoid. These things you should avoid during the hypertension. And also, you should not eat too much of salty food. Try to stay, very less salt. Eat foods which is high, avoid to eat in saturated fats. Smoke, tobacco, avoid it. Drink too much of alcohol, and also reducing the hypertension prevents the heart attacks, strokes, and kidney damages as well. So this is the overall concept you should take care in the yoga therapy. The most important aspect is you should definitely do not do the inverted postures, which is I'm not recommended to any of the hypertensive patients. And also, you should eat healthy things and in the manageable amount, and do not take too much of saturated and trans fats, because what happens when you can see, like those who have the condition of hypertension, you should get type 2 diabetes as well, and even the cholesterol. So these three things are combined together. So you should rather avoid some these things and change in a lifestyle, so you can easily take care of your own body. So this is all about the hypertension and what is the role of the diet. Thank you so much for attending it.